Good afternoon. Today is April 6th, and I'm Rob Brandt, CEO of Mountain View Medical Center, and with me today again is Eva Kerr, our Director of Public Health. The current state of affairs, we have conducted 11 tests, 1 positive, and that positive has been fully recovered. The other 10 tests are all negative, which is great news for our community, and so I want to applaud everyone for continuing to observe the social distancing and the sheltering in place orders by Governor Bullock, and continue to utilize all the services provided in our community by all of the businesses on Main Street and off Main Street for curbside or delivery services. Please keep it up, White Sulphur. We're doing a great job. And it's not over yet, as a lot of the models are still continuing to show that we've got a couple more weeks of this, but time is the only thing that's going to tell. None of us really know what's going to happen, but hang in there and we'll all get through this together. As it stands for this week, we're going to continue on with 1 provider in our clinic and have clinic operations, trying to have more people do telemedicine. We will see someone in person on an as-needed basis, but we'd really like you to utilize the telemedicine offerings that we have this week. And as we have our clinic staff coming back on Thursday of this week after being fully cleared, and our 1 positive employee being fully recovered and cleared back for work on Thursday, we'll look to modify some of our clinic operations going into next week. So stay tuned for that. Eva, do you have any additional information for our community today?
Yeah, so one thing I forgot to mention last week that has been kind of a topic is people returning to Montana from other states. If they were snowbirds or if they were just out of the state for a period of time, they really need to stay home for 14 days and quarantine. That was a directive from Governor Bullock about 2 weeks ago. So please do follow that. Use the delivery systems, use other people to help you get what you need from the stores or your supplies, but try your best to stay home quarantine during those 14 days. And if symptoms arise, please notify the hospital at 547-3321, and they can help screen you and help you make decisions on what you need to do. I also want to talk about masks. So Friday when we left this, masks were starting to be discussed, and by that afternoon or by that evening, it was CDC recommendations. So what the CDC has found is that people who don't show symptoms for up to 2 days before they have symptoms could be passing on COVID-19. So if you are in a grocery store, a pharmacy, somewhere that is a little closer, hard to maintain the 6-foot social distancing, the recommendation is to wear a mask. I did put a couple things on the Facebook page today, the Mark County Health Facebook page, about how to make your own mask at home. And the other one is guidance about making sure it covers up above your nose, down to your chin. Couple recommendations are no one under 2 should have a mask, and if you can't pull it off yourself, like if you are comatose or if you're trying to help somebody that is comatose, don't put a mask on. We don't want them to suffocate. The big things from CDC is please do not get the surgical masks or the N95 mask. Please leave those for medical staff. They're in a high demand right now. Homemade masks are exactly what you need out in the public, is what's being recommended. Like I said, on the Facebook page, there's some good information there on what you need to do. This doesn't give you the full, I don't want this to give you the false security that you should be going out in public a whole bunch now because you have a mask on. The mask is not going to really protect you from other people, but it'll protect other people from you, if that makes sense. So if I was a carrier of it and I had the mask on, that's going to help me from spreading it to other people. So please still use the services, shelter at home like we've been requested to do, and follow those directions that we've been given. The most important thing we can do is stay home and stay healthy. That's what I have for today.
Perfect. Thank you, Eva. And Eva's right. We still need you to stay at home. Don't want you to have a self-confidence of going out into public with a mask on, thinking that everything's okay yet. Please stay at home, still observe all of the shelter-in-place orders, and we will try to update you on Friday again by 5, and we'll take it from there as our spread may or may not continue to happen, and we'll try to keep you updated to the best of our ability. Again, if you have any questions, email clinical@mvmc.org, and you can check out our website, www.mvmc.org, and the Mark County Public Facebook page for any updated information. Thanks. Have a great week.